And I'd like to call this meeting to order and ask, can we confirm that we have quorum? Oh, hi, Lori. Nice to see you. We don't get to see everybody on the screen all the time, so I hadn't seen you yet. Do we know whether we have quorum, Tina? We have 14 members. We have quorum. Excellent. Quorum confirmed. Do we? Anybody have an objection to the agenda? No. A mover? Thank you, Jim. Thank you, Dale. Any objections? I hear none. Thank you. Approval of the minutes of September 21st, 2020. Have any comments been received for those minutes? No. Then I would accept a motion in that regard. Marianne, are you ready to move? And Samira, thank you. Any objections or comments on the minutes? No. I will take them as agreed to. We have, as usual, approval of item 5 is approval of consent items, which members of the board have received. And are there any items in the consent items that board members would like to have removed or have a discussion on separately? Hearing none, I would ask for a motion on the consent items, which have been vetted by their various committees before getting here. Thank you, Marianne, and thank you, André. Any objections to the motion? No, I consider the consent items approved. Now we would move to the report of Dr. Feller. And it's
Merci, Monsieur le Président. A brief report on the situation with COVID-19. At the present moment, we are, of course, involved in the treatment and providing services to COVID-19 patients. As of yesterday at 4 o'clock, at 5 o'clock rather, when we had the meeting of the Centre de Coordination des Mesures d'Urgence, we had 17 patients at the MUHC with a diagnosis of COVID-19. 10 of these patients were on the C9 ward at the Glen site on the adult side, and 6 patients were in the ICU at the Glen and 1 patient at the Montreal General Hospital. We had no patients at the Montreal Children's yesterday afternoon. It is very seldom that we do have patients at the Children's because, as you know, COVID-19 doesn't affect children as much as adults. And usually when we have a patient at the Children, it's because of a pre-existing condition. So at the present moment, we don't have any patients. We are busy in our emergency rooms. There are challenges related to infrastructures, so we are putting up temporary structures both at the general and at Lachine. Lachine will come first. The general should come in January, and that will permit us to deal better with the COVID-19 pandemic. At Camille Lefebvre, we had to stop all visits because we do have an outbreak amongst our personnel. We have 3 staff members who have become infected with the COVID-19 virus as of this week. And so we have stopped all visits to Camille Lefebvre in order to protect our patients who need the ventilatory support in one of the wards of Camille Lefebvre. Our lab, we still have our Centre de Dépistage, which is open. We are seeing less patients. This is a trend ever since the Thanksgiving weekend. The less people are showing up for testing, and this is a provincial trend at the present moment. We are dispatching a team of infection prevention and control at the request of the Ministry of Health. Today, they are in Montérégie, in Marieville, CHSLD Sainte-Croix. That is one of the CHSLD that was in the medias yesterday, for which Premier Legault and Minister Dubé required assistance, expertise from supra-specialized centers. So Dr. Charles Frenette and one of his team members is today in Marieville and will be Monday in Brossard, in another CHSLD that also requires support because they are either considered red or yellow. Of course, the well-being of our staff is one of our most important concerns at the present moment. We know people are tired, and we're trying to support them as much as we can. We're trying to conciliate family duties and quality of work of life at work. We're having a discussion twice a week with our union partners, and I have to say that the climate with our union partners is good. The discussions are very positive. We're trying to find solutions to problems, and I would like to thank them for their collaboration in these difficult times. So hopefully this second wave will be over by Christmas. Hopefully we'll be able to enjoy Christmas vacations and for the new year as usual. But it's difficult to say because the number of cases has remained stable in Quebec with daily about 1,000 to 1,100 cases a day. So we don't know if it's peaking or if it's an artifact that results from the fact that we're testing less people daily in Quebec. So we will be on the watch for this. So we're doing exactly like what we did during the first wave. We're taking care of our COVID patients, also taking care of our other patients. We're functioning at a level of about 80% for our regular activities, pre-COVID activities, which is quite good in the Montreal context. We're also doing well with our healthcare workers. 2 weeks ago, we had 19 healthcare workers who newly developed the infection. Last week, it was 10, and this week, it's been only 3. So out of it, 12,000 people, these are good numbers. So that would be my report on the COVID-19 situation, Monsieur le Président.
Thank you, Dr. Feller. Are there any questions of Dr. Feller on his report? Tina, are you seeing any hands raised? No hands raised. All right. Thank you for that. We will then move to public question. I believe one was answered at the previous meeting, and you may have one left for this one.
We have one question for this regular public board meeting. The question is from one of our colleagues and one of our administrative assistant, Madame Lorna Koppen. So BLM, Black Lives Matter. Question A, where are the board members at with the MUHC policy? Question B, since forming this committee, it's not a question actually, Mrs. Koppen is saying that since forming this committee, we have not had any concrete strategy on this issue. She would like to know about the timeline, the feedback, and our employees going to be informed of the progress. And she also asked, would the committee consider forming mini groups comprised of employees from each service for their input, experiences, and challenges they have encountered? And she thanks us for this opportunity in spearheading this challenge. So we've had discussion yesterday with the two chairs of the committee, Madame Ramdas and Dr. Brown Johnson.
So first of all, thank you very much to Madame Copin for the question. I would perhaps should qualify just to mention that the CADE committee, though it was mentioned in the public board meeting of June or earlier this summer, the actual formal creation of the committee through the necessary processes that were required, including, review by the governance committee and vote and adoption by the board. Those steps were only completed in late September, and therefore the committee was officially born at that point in time. Since then, we have developed the terms of reference for the committee. We have also developed or identified the key roles. So since the end of September, we have, finalized the terms of reference. We have also developed certain timelines that are included in the terms of reference, or the process that we proposed. And we had formal. We began inviting recruiting members of the core committee, as well as some ad hoc committee members. Of the 11 members of the core committee, we have now confirmed all but about three are still outstanding. But we anticipate, hopefully within the next week to have all those positions confirmed. We've had tremendous interest. We've had people coming forward who, even before we would have reached out to them, offering to play certain roles, and also with very interesting ideas of an educational value. And so that has also helped our recruitment to ad hoc committees that will come later. With respect to your specific question regarding, what type of concrete strategies, our commitment and our intent and our commitment is to hear all voices, all perspectives, to create opportunities for every stakeholder, every constituent in the MUHC to share with us their concerns, their lived experiences, their ideas, and including innovative solutions that we will hope that you will be a part of. To do that, we're planning to have at some point focus groups that will occur later based on the results of some surveys that we'll be sending out, where you will have the option of responding anonymously or not. You could certainly identify yourself in those responses. We also, those surveys will be helping to determine where are the priority needs, if you will. We want the MUHC community to inform us about their views of what the priority needs are. And then that will help to inform the development of the focus groups. Though some focus groups we already know because the need is so obvious and stark. And we have already reached out to some collaborators who would be interested and knowledgeable and have expertise in those specific areas. We have also the intention, we have asked for a unique or a dedicated telephone line to be established where the community could also call and indicate their concerns and so on. That is still awaiting approval, but that's one idea we had. And also we asked for a specific email account for the CADE activities, to which again, one could send comments, ideas to Sita and I. We plan to be very, very respectful of the confidentiality and the sensitivity of this issue. We expect at some point that there will be perhaps uncomfortable conversations, and we want people to be comfortable in embarking on those discussions. We want to create safe spaces to encourage those discussions. So I hope that you will be comfortable in communicating your views when that development arises. So I think, I hope that gives you an idea as to the different types of forums that we anticipate. We also expect to invite certain constituents to present to our committee, but also we envision perhaps some type of a webinar format later on. We will first give the board of directors an update, at some point be presenting to the larger MUHC community.
So I just wanted to add, thank you, Anita, for covering the question, and to address Ms. Lorna directly. I do know, Ms. Lorna, we are ensuring that our committee really adheres to that inclusion component as well. across intersectionality. So it's more than just cultural diversity, it's social diversity, it's intersectionality at all points. And we're confident that we are going to have a very comprehensive and very representative set of members. We're really grateful for the enthusiasm that we've seen already. And there will definitely be ad hoc committees that will be led by different individuals, again, from different intersectionalities, to address the tsunami of issues that we anticipate that will be raised in very sensitive discussions. And we are striving to have very evidence-based policy making and processes that are defined through the gathering, not just of socioculturally relevant and applicable data, but also recognizing that lived experiences are evidence as well.
That is very, very helpful, Sita. Are there any members of the board who have questions or comments at this point on this issue? I might just jump in to say that I think this is a monumental issue in terms of the breadth and the depth of it, as it already has been characterized, and that mitigates against arriving at results in a quick fashion. I think doing it well is very important, and I think that the fact that you're taking the time to reach out to the groups that you think are important is absolutely critical. But we did include a request to get an update at the December board meeting. So that's a deadline which doesn't have a specific result attached to it. So in a sense, it'll be whatever it'll be. But I would encourage the committee to attempt to deal with this in bite-sized pieces so that we can actually have some results coming from it. And I don't know whether the 80-20 rule is applicable in this situation. In business, we talk about 80% of your business is 20% of your customers, and sometimes 80% of your problems is 20% of one type of issue. If that happens to be the case in this area, then I would encourage focusing on getting the big things or dealing with those things that could have the biggest impact, where a change could have the biggest impact faster than not. And I'm not trying to characterize the challenge or the problem, because I'm not knowledgeable about it, but that was just a hope that we could actually see some results, some thoughts, some suggestions, some approach in due course. And I wish the committee well. I know it's a big job, and I'm grateful to them to take it on. Dr. Feller, if there's anything else?
C'était la seule question, M. Craig. Peut-être que j'ajouterais, I would add that we're trying to expand the types of experience we have around in this committee. Yesterday, we had good news, and I shared that with Dr. Brown Johnson and Mrs. Ramdas. We did ask our Inuit partners to delegate someone to help us, to have an external member for our committee. And we're glad to tell you that Monsieur Fabien Pernet, who's the assistant to Mrs. Minnie Gray, who's the CEO of the Inuit Nation Health System, will be sitting on the committee with us. Monsieur Pernet holds a PhD in ethnology. He wrote his thesis on the Inuit culture, and he's very involved with EDI's challenges and topics. So it's going to be a big plus for the committee. Voilà.
Excellent. That's great news. Thank you, Dr. Feller. Are there any other issues that need to be brought before the committee or the board at this point in time? Anyone has their hand raised? Tina? No? Well, thank you very much. It's been a long morning. I appreciate your loyalty to sticking with us throughout, and I wish you a good month. I guess we're not seeing each other for another 6 weeks.
We're seeing each other in December.
In December. Okay, so as they said, we'll see you in December. Cheers.
Merci beaucoup.
Thank you.